Continuing Healthcare Assessment, the Key Indicators, Part 1, Nature. And for reference, hi, I'm Sean, an adult social worker, and we're looking at why scoring low, moderate, high, severe or priority are not the only things that get looked at in an assessment. They also look at the 4 key things: nature, intensity, complexity and unpredictability of a person's needs. So let's discuss nature. Nature describes the particular characteristics of an individual's needs, which can include physical, mental health, or psychological needs, and the overall effect of those needs on the individual, including the type, so the quality, of interventions required to manage them. So in this one, the questions to ask is, what is the need? Is it physical, psychological, or both? Is it chronic or life-limiting? What does the care involve? Who does it need to be completed by, and does that person need a particular skill? What would happen if those needs weren't met in a timely way? So I'm going to give you an example, which I'm completely making up here. So person X has a learning disability and epilepsy. And with his learning disability, he needs prompts to initiate and sequence daily tasks. With the epilepsy, he needs carers to be trained to give rescue medication and be able to spot signs of a seizure happening. He also self-harms regularly, digging his nails into his skin and pulling hair out. And he can hit others. There has been no identified pattern to what causes this, despite having a one-to-one support plan and mitigations being put in place to help protect him and others. This has not always been successful. So person X requires a registered nurse to give risperidone when required, but again, this might not always be effective. If this wasn't in, the frequency and intensity of those attacks would increase. So next in the series is intensity. So please follow along to ensure you don't miss it.